990 is a talk line that was established on December 1st, 2003 with the support of Zambia Integrated Health Program, a USAID-funded project, Toyota Zambia, and National AIDS Network.
990 started off in 2003 with support from the Health Communications Project, which was a project funded by USAID. It was then supported through the years until the project ended. But during that time, the service was available to the public via phone. So people would call in using the telephone, and it was mainly via Zamtel through the terrestrial lines, and then when Cell Z came on, it was also available on Cell Z. So it was, for that time, available on both Zamtel telephones and the cellular network. Later on, it then became available also on Airtel, and again, access was mainly by phone.
The talk line was originally called HIV Talk Line and started with 8 female counselors, all of whom had medical backgrounds. These counselors were supported by part-time male and expert counselors who were available on demand. For many years, the service was accessible on the Zamtel network only and dealt with HIV issues ranging from counseling to referring individuals for services across the country.
In the later years, we then got support again in 2011 from Communication Support for Health Project, again a project funded by USAID, where now in this program we are expanding 990 to cover more areas.
In 2009, the Zambian government, through the Zambia Information Communications Technology Authority, ZICTA, designated 990 as an official emergency line. The service is now toll-free on all networks, namely Zamtel, Airtel, and MTN.
Similar to how you would call the police or the fire station, you can now call 990 toll-free, which means it's now available on all networks.
The 990 talk line operates 24 hours a day, 7 days a week, 365 days a year.
990 talk line is a toll-free confidential counseling line where people are able to call from the comfort of their homes without even thinking of transport money to go to a payphone to go and make a call. The 990 call center is manned by 19 counselors, and among these counselors we have male counselors as well as female counselors. There are some counselors with a medical background and others have a social background.
In 2011, CHAMP received support from the Communication Support Health CSH project, a USAID-funded project to expand and enhance the 990 service.
The counselors on the call center are able to speak different languages, especially the 7 major languages in Zambia. So all people calling the call center are covered.
The counselors have standardized training and information, ensuring that core concepts are internalized by each individual. The training has made CHAMP 990 counselors unique from other counselors and appreciated by many callers.
When callers call the counselors, they are able to counsel as well as give advice and refer to appropriate services pertaining to the caller's problem.
The CSH support will help 990 transform itself from being an HIV and AIDS line to being a truly national health and support service resource.
The counselors are able to capture data at the same time as they are talking to a caller. So they are able to capture the age, the sex, where the caller is calling from, because this is a service that is provided throughout the country. We would also like to know how far the coverage has gone and if people even in remote places know about 990.
Key health areas of enhancements include maternal, newborn, child health, nutritional, malaria, and family planning/productive health. The enhancements include technological enhancements and marketing of the service.
What we're doing with the expansion is to make the service available online as well via the internet. And what we've done is through the support, we've developed a web portal. And on this portal, people will be able to access information as opposed to just waiting to call in. You can actually go to the site and access information as though you were interrogating a counselor.
The web portal will provide users the opportunity to access and download informative health-related materials. To market the 990 talk line, awareness through CHAMP activities have continued to be used to promote the 990 talk line to the general public, with an emphasis of reaching all areas of Zambia using a variety of methodologies including radio, television and print media. Currently, 990 continues to be supported by USAID-supported Communications Support for Health Project, International Office of Migration (IOM) on human trafficking issues, UNICEF, Brothers for Life on male involvement issues, Society for Family Health on male circumcision, Zamtel, Airtel and MTN. The support of these partners has enabled the 990 talk line expand the services and reach to the general public. This launch will mark the beginning of a new marketing campaign for the expanded 990 talk line. The marketing campaign starts with the unveiling of the 990 logo and showcase the new lenses, but will eventually feature press ads, radio adverts, and billboards and posters around Lusaka and eventually throughout the country. The aim of the marketing campaign will be to raise awareness about the expanded 990 in every corner of the country.
I started using the talk line 990 in 2008. That was after my divorce. And at that time I'd just been tested HIV positive just before the divorce. Now, because of the problems that I was going through, I had not yet accepted, I saw the advert on TV, and even on the adverts were all over anyway. Then I tried 990. The first time I called, I was nervous, but I found help. I talked to a counselor called Miriam. This counselor, helped me a lot. That eventually I started calling for more help. As I'm talking to you right now, I don't fear anything because I've grown, I've lived on, and I've become another counselor out there. I do help a lot. I help my fellow women and even the youth in schools, because I'm a teacher at one of the government schools just here in Lusaka.
Join us in the launching of the new 990 logo. CHAMP, sharing tomorrow's quality health today.